When you begin your treatment, your radiation therapists will introduce themselves to you and describe what's going to happen. You're welcome to have a support person accompany you. On one of your treatment days, it may be possible for your support person to come into the treatment room to observe your treatment setup. An appropriate day can be organised with treatment staff. To ensure you get the best possible support, please inform your radiation therapists if you experience any problems with your radiation treatment.
My partner was able to come in and have a look what they actually did. It wasn't this big scary room that you kind of walked down the hallway to and you disappeared for 5 minutes and then came out.
Well, it was 7 weeks, and when they said 7 weeks at the start, for a busy person like myself, it sounded an absolute nightmare of being that long. But once we started to get into it and we were moving through the 37 treatments, yes, it went very quickly.
They allowed me to take my own music, so I took Fijian music, and it's a special place for my husband and I, so we love Fiji. So I had my Fiji music, and the machine was my palm tree and my bed was my beach, and that's how I got through my treatment.
There we are, put your basket down there, put your glasses with it. Thank you.
Radiation therapists will position you on the treatment couch in exactly the same way as you were in the CT scanner. The lights are turned down and red laser lights are matched to the marks on your skin.
Okay, so we're just going to set you up here.
Lights at the head of the machine project onto the skin and are used to verify the setup.
Keep you warm. Okay, we're ready to go now, nice and still.
Once in the correct position, the machine is moved to the first treatment angle. It is important to keep as still as possible. If you want to stop treatment because you think you have moved, raise your hand and the radiation therapist will come into the room. The machine is operated from the console area outside the treatment room. Although alone in the room, the staff are monitoring you through a closed-circuit TV camera and intercom. You may be treated from more than one direction, and often the machine will be moved by the radiation therapists from outside the room. The time the machine is on varies between a few seconds to a couple of minutes. The machine creates some noise while operating. However, you will not see or feel the radiation.
How was it?
Routinely during your treatment, you'll see the doctor.
How are things going with the radiotherapy?
I think.
Okay, so no skin reaction around the side where you're wearing the mask?
It's starting to, just beginning to.
Radiation therapy can cause side effects. Side effects vary between each individual and depend on the area of the body being treated. Unlike other forms of treatment, radiation therapy side effects are localised to the treated area. Your doctor will discuss this with you.
Comfortable, and it's also in the side of the neck. So as the time goes on, as your reaction gets more severe, we can give you some creams and some lotions to help with the reaction in the skin, and some painkillers for inside the mouth as well. Okay?
To start off with, it didn't seem to affect me at all, except that I felt tired. And as I've said, I'm usually a very busy person, but I found that I really had to take time off and have a bit of a rest. But apart from that, it was okay.
The linear accelerator creates two distinct forms of radiation: electrons and photons. An electron beam is accelerated down a linear guide and directed towards the patient. To create photons, a metal target is inserted into the beam. The machines undergo daily quality assurance testing and are serviced regularly. Radiation therapy treatment programs can vary between one treatment and up to 7 weeks of treatment. Appointment bookings are made with the consideration of many factors, due to the large number of patients receiving treatment and the number of patients from outside of the Palmerston North area. It is not always feasible to give appointment times that will suit everybody. Staff will do their best to accommodate where possible.